Hi, it's 7 a.m. here in the morning, and the sun is shining through the window. So I decided to make my video with the sun in my face. Today it's still not too warm, so it's not hurting my skin. So I'll take it while I can. There's something I wanted to mention concerning my appointment with the doctor. We also talked about healing and the schedule for, when am I going to be well, which is one of the first times we talked about it because we all knew that it's such a long process that it's not something we could discuss in the first appointment because the doctor simply doesn't know how I'm going to react, what's going to be possible. But now, after 4 months, I'm on all of my pills already, except for one at their maximum strength, um, and we're starting to see improvement. And so, one thing during the appointment, he asked me to rate how I'm doing, which is like an impossible question to answer, because and he meant to say that on a percentage, and so it's impossible because there's so many factors, and once you think of one number it seems wrong for all the like right reasons, and um, but we thought about it, and with Jan we discussed this even after the appointment, and if if I have to quantify, and I guess I have to because we need to start somewhere, I would say that when I found out I had Lyme disease and started treatment, I was about at 15% functional. During treatment at my worst, I got to about 5%, and that was the worst when I couldn't walk, had to shower sitting on a chair, eating was very difficult, and etc. And obviously, there was a lot of pain as well, and a lot of different symptoms that I can't all list at once. And by now, I would say that I'm about a 25, so that's pretty encouraging. Um, and uh, and so we're hoping to get to 100%, right? So this is what we spoke about with the doctor. He says that essentially I'll be taking these antibiotics, all of them, until I feel great. And then I'll continue taking them for about 6 to 8 weeks, and then I'll stop, and hopefully I'm all done, everything's great. So this is the best case scenario. If I continue improving and then reach a plateau, and I don't get any better, then we're going to test for some co-infections and also look into other issues such as heavy metal toxicity, um, especially since I have the MTHFR mutation. That becomes more of an issue. Um, and yeah, in terms of time frame, we don't have one. I am doing really well, and so I expect to. I'm hoping it's going to be less than the 2 years, but you never know. You never know how your body's going to react, when it's going to stop reacting to something, why it would. Um, Patience is key, and kind of the ability to not know, to accept the unknown. Um, but overall, it's very positive, and 25% is much better than 15, and it's much better than 5, and it's very encouraging. Um, and I have high hopes that it's going to continue doing well. Now, that all is being said, 4 months in, after all I've read and understood, I think the best way to talk about chronic Lyme disease, and the reason why it's called chronic Lyme disease, is because at best you can be in remission. And you can be in remission for the rest of your life. But it's impossible or difficult, or I'm not sure exactly which one, to eradicate all of the infection in your body from the Borrelia and other co-infections. And it's also impossible to know that you've eradicated it all, because you'd have to test every single piece of your body, because many tests for Lyme disease test antibodies which remain in your body. So if you're actually looking for the bacteria itself, well, it's could be anywhere, right? In a sense. Um, so you can be healed in the sense where you don't have any symptoms. You can also be asymptomatic for some time and then have a relapse. So this is something that I'm going to have to manage my whole life, but hopefully once I heal and my immune system kind of takes over and can kind of hover around my infections, let's say, for the rest of my life and kind of keep them at bay, then I should be able to live a completely normal life. Interestingly enough, this same thing happens with AIDS, where some patients have the HIV virus, but don't get sick because their immune system keeps it at bay. So obviously, I have gotten sick, um, but unlike HIV, these antibiotics are actually supposed to be, a treatment and a cure for Lyme disease. So it's all a bit tricky. I'm pretty sure, they're going to develop new things in the next 5, 10, 20 years for Lyme disease. So hopefully it's going to be even easier to treat and, well, hopefully much easier to diagnose and all the other political crap that I've already spoken about. So that's about it for my prognosis. Have a wonderful weekend, guys.